What is medicine? In the 21st century, we tend too often to think of medicine as pills, powders, potions, or procedures. Something you get from a doctor or the drugstore, or something that a doctor or a therapist does to you to make you well or keep you healthy. And yeah, those things are medicine, and they dominate modern healthcare. They're part of the disease-oriented model of modern medical practice. And you should be glad that you live in a world where a surgeon can yank out a hot appendix, a cath lab is standing by in case you have a heart attack, and there are pills to help you fight off an infection, or treat your high blood pressure, or ease the pain of your creaky joints. But medicine isn't all about getting well, or at least it shouldn't be. It should be mostly about staying well and living well. Health will never come in a pill, my friends. Hi, I'm Jonathon Sullivan, and welcome back to Greysteel. For most of human history, medicine wasn't in a good position to fight disease, because we didn't even understand disease, or even the basics of biology. Physicians and barber surgeons might be able to treat a wound or a kidney stone or a boil, but an acute appendicitis or a vascular emergency or a deep space infection, forget about it. The best ancient medicine focused on staying strong and healthy, and a big part of that project was the integration of the physical being with the natural, social, psychological, and spiritual worlds. So yeah, a lot of ancient medicine looked like this. But it also looked like this, and this, and this. From the perspective of modern medicine, the effectiveness of a tribal dance or a poultice to maintain health or combat disease may not seem very impressive. And it's true that a lot of ancient and medieval medicine was misguided and even counterproductive. But it gave our ancestors a sense that they had some degree of control over health and disease. That idea of control is also important to modern medicine, which aims not only to maintain health, but to combat and control disease. And our idea of control is only slightly less illusory than that of a medieval physician like Paracelsus here. We still suck at the treatment of the chronic degenerative diseases of aging. Stroke therapy, despite the advent of controversial and risky new reperfusion strategies, remains in the Dark Ages. And the repair of brain tissue after stroke and other forms of brain injury is still decades away, if not longer. We've made progress against cancer, but there are cancers and there are cancers, and these neoplastic diseases remain major killers. We treat heart failure, hypertension, atherosclerosis, and diabetes mostly by attacking the signs and symptoms and attempting to modulate the physiology rather than getting to the root of the disease. We can't cure any of these conditions yet. Let me say that again. We don't have cures for stroke, heart failure, high blood pressure, diabetes, dementia, all of them major causes of mortality and suffering in modern aging populations. Our pills, potions, and procedures can definitely stabilize the situation and they make people feel better, but they don't cure and they don't make people healthy. Health doesn't come in a pill. It can't. Part of staying healthy is not getting chronic diseases in the first place. And when it comes to that, there are two kinds of factors. Factors that we can control and factors that we cannot control. The factors that we can't control include our heredity, the kind of world we live in, our luck, and to a greater or lesser extent, our environment. You can't choose your parents, or to be born into a different century, or to have not contracted rheumatic fever or viral myocarditis as a child. C'est la vie. But the factors we can control are, well, under our control. We can get a handle on how we live, what we eat, how and if we exercise, whether we use alcohol or tobacco, or crack, or crank, or heroin, whether we don't sweat the small stuff or freak out over little things, whether we get enough sleep, you get the picture. Again, the way we live is a kind of medicine, and it can be a good medicine or a potion of evil, or, as is more likely the case, some mixture of both. You have a pretty good diet, but you smoke and you don't exercise? That's not great. But the good news is that you have pretty clear opportunities to increase the amount of good medicine in your life and decrease the bad. A particularly powerful form of lifestyle medicine, probably the most powerful, is exercise. The more closely scientists look at the impact of exercise on health and disease, the more potent it appears to be. Exercise has beneficial effects on virtually every organ system. It has powerful preventative or therapeutic impacts on cardiovascular disease, adult onset diabetes and metabolic syndrome, cognitive decline and dementia, and of course, muscle and bone atrophy. It promotes better body composition and is the single best medicine we have to fight frailty in the aging population. The profound beneficial impact of exercise on health and disease is now so well established that it's become very fashionable to talk about exercise as a medicine. For example, the American College of Sports Medicine is behind an international initiative called Exercise is Medicine. They also trademarked the phrase, which seems a little bit like trademarking the heart pumps blood or insulin controls blood sugar. I'm sure their hearts are in the right place, but you got to wonder if the ACSM is going to go after the British Journal of Sports Medicine for publishing this article entitled, "Exercise is Medicine, and Doctors Need to Prescribe It." Well, yeah, it is medicine, and doctors do need to prescribe it. The problem is, we don't. Not nearly as often as we should anyway, and even when we do, we usually don't do it right. There are a couple of reasons for this. First of all, while doctors get a smattering of exercise physiology and sports medicine in their training, they don't really learn how to prescribe exercise as a lifestyle medicine for their patients. And this is mostly because of reason number 2, which is that there's no broad consensus on how to do that. So the closest most doctors come is telling their patients, just get some exercise. This is a little bit like your doctor telling you that you have an infection and writing a prescription that says, just take some antibiotics. This will not do. If exercise is a medicine, the most powerful medicine in our arsenal against the depredations of chronic disease and aging, then we should indeed prescribe it as a medicine. This has very significant implications, as we'll discuss in detail in the episodes ahead. The important thing I'd like you to take away now is that while you can't turn back the clock, change your genetics, or undo much of the damage already caused by your experiences, habits, and environment, there are ways to increase the amount of good medicine in your life. Exercise is one of those ways, along with proper diet, sleep, stress reduction, and the elimination of environmental hazards and toxins. All of these approaches have powerful impacts on the way we age, and we're going to discuss them all. But exercise is where we're going to focus most of our attention, because exercise is the most powerful, immediately available, rapidly acting, and quantifiable form of lifestyle medicine. It is also, perhaps, the most misunderstood. We're going to change that in the episodes ahead as we discuss exactly what we should expect from our exercise medicine, what requirements it should meet, and what form of exercise best fits the bill as a general exercise prescription for the aging adult. You guys have been patient with this didactic material over the last few episodes. We've almost finished laying the groundwork, and we're going to be moving into more practical territory soon. Like in our very next episode, when we discuss 5 clear and present dangers to your health that you can address immediately for a profound effect on your health and well-being. Until then, thanks for watching this episode of Greysteel. Our content is provided for educational and infotainment purposes only and will never be offered as medical advice for any particular person, patient, disease, or condition. When it comes to your health, you should work closely with your physician. Make sure you check out the doobly-doo for some interesting links and resources, including our new book, The Barbell Prescription, Strength Training for Life After 40. The definitive new text on the why, what, and how of training for health in middle age and beyond. A big shout out to our very first Patreon supporters, Grady, Emily, Mark, and Warren. If you'd like to help us make more of these videos or put them up more often, go to patreon.com/Greysteel. Or if you just want to learn more about healthy aging, go to youtube.com/Greysteel and subscribe to our channel. Stay strong and stay healthy.